Please welcome to the stage AWHONN Chief Executive Officer Jonathan Webb and AWHONN President Sandy Cesario.
Good morning, everyone. Thank you for being here so early in the morning. I know this is an important topic to many, many of you. First, just a couple of housekeeping notes before we get started. This session is being live streamed to our full membership, so be aware of that. And if you have questions or discussion, we have 3 people in the audience who have a microphone, and we'd like you to ask those questions in the microphone so we can make sure it gets communicated to everyone. Please raise your hand so we can call on you and they'll bring you that microphone. We're asking you to please keep your comments brief and on topic, under 2 minutes if at all possible, so everybody has an opportunity to speak today if you have something. But you were invited here today to talk with each other about the SCOTUS decision that was made on Friday that overturned Roe versus Wade. Politically and personally, a sensitive topic. We may not all feel the same, and that's okay. That's what this is all about. We need to know how you feel. We want you to express your thoughts. It helps us determine our future as an organization, how we can best meet your needs. So let's keep this a safe space among friends and colleagues to speak openly and respectfully to each other, and just remember that respectfulness, and it's just so important we hear your voice. It has been a long-standing AWHONN position on reproductive care. Nothing is changing in what our positions or policies have said since 1989. This is a long time. Reproductive health decisions we've made the position statement that these decisions are best made between a person and their health care provider. AWHONN supports and promotes a woman's right to evidence-based, accurate, complete information and access to the full range of reproductive health care services. AWHONN also opposes legislation and policies that limit a health care provider's ability to counsel women as to the full range of options that are available to them and provide treatment and/or referrals that are necessary. Jonathan, do you have a few words?
Thank you, Sandy. As you've seen with our statements that we've released and the partners that we've engaged with, we are trying to be very clear that this is not a political statement the organization is making. We're making one that is based on patient health and patient safety. This is about providing care in the best possible manner and the safest way, which we believe is to have options available to you and your patients in that environment. No matter which side of the political fence you're on, we all want safe and healthy patients. We want healthcare clinicians to be able to counsel patients on their full range of options and to provide treatment. Black and brown women and women in lower socioeconomic statuses will be more negatively impacted, and the statistics show us that. So we wanted to level set and provide a little bit of a groundwork or framework for our conversation today. We want you to be able to share your thoughts and ideas, but hopefully not get into a back and forth debate on politics. More so hear from you about if you want to share with us what your thoughts are, great. We'd also like to hear what your needs may be as this post-Roe environment is changing. So as we meet your needs, we'll have folks in the room taking notes so we can better understand what those challenges might be so we can provide some support and resources to you in this post-Roe world. So enough from us. Please share with us your thoughts and feelings with us by getting the attention of a mic holder who are our board members. So if you have something to share, we're asking you to raise your hand, and the person with the mic closest to you will come to you, one of our board members. Please remember to keep your comments brief so everyone has a chance to speak.
I believe, yeah.
Hi, my name's Jen Atkins. I'm from Oregon. I'm also on the policy committee. And I just was curious because I noticed that next year our convention is going to be in Louisiana, which is a state that has heavy criminal penalties for clinicians. And as a clinician who does this type of work, where it's still legal in Oregon, in the inpatient setting. Has the committee, I know they've put in a ton of work. These things are planned years in advance, but what is AWHONN's plans for handling our presence in that state next summer?
That's a great question. That's a great question. We actually spent a decent amount of time over the last couple of days at our board meeting trying to figure out what our next steps will be. There are a number of things that we're weighing. So as a bit of background, it's about $2 or $3 million worth of liability if we pull out of a contract, and those contracts that we have with hotels are negotiated 2 to 5 years in advance. So there's that consideration. We're also thinking about the needs of our members who are in some of these states and how we might best support them, because if we move conferences, there may be a hardship to them because they're expecting to be able to come to a conference locally versus travel again. We're also managing, trying to understand what the best course of action might be to actually bring about real change. While there's an opportunity to make a national statement by not having a conference in state, we also believe there's people on the ground who are impacted by that, because especially in places like New Orleans, where the economy is supported by the hospitality industry, there are people at the end of that stream who will be impacted if we don't bring and provide resources in those areas. People's livelihoods are impacted. And in many cases, there are people who are below a socioeconomic status. So while we're making a political statement, we also want to make sure we're being mindful of them. So we haven't really landed on what we're going to do about the conference next year, but we're engaged in debate about what's the appropriate action to make sure we have minimal financial risk, we're able to make an impact in our advocacy efforts without negatively impacting those folks on the ground.
And we also have had the discussion about what to do in the future. If we end up being kind of locked into the New Orleans conference, it is something we want you to know that we really have thought about very in much detail, and that we will look at that moving forward.
And the other point of consideration is that as we do this work in this space, which is obviously extremely important, we may be faced with the reality that our options for convention will become very limited. Currently, there are 26 states, I believe, that have this as a legislative action. So our options will become very limited, which will put us in positions where some of our costs may increase, because some of the areas that we're going to go to that have favorable legislation have higher fees. So we're trying to navigate all of that in a respectful way that also gets our mission advanced.
Thank you. I think, Elizabeth, you have someone there.
Hi, yes. We talk about the impact on lower socioeconomic patients. Does AWHONN have a plan for maybe fundraising for travel or getting people to where they need to go for these kinds of services?
For
patients or for members or?
For patients.
We have not.
No, that has not come up in our discussion, but thank you. This is just what this is for. We will certainly look at that. I appreciate your comment. Another Elizabeth person.
Keeping Elizabeth busy. Good morning. I'm Debbie Ketchum, and I am on the Public Policy Committee as well. And we spent some good time looking over the statement for AWHONN and revising it. And so thank you for sharing that. I'm from the state of Idaho, and we have a trigger law that will go into effect. And I was reading over it, and our governor really wants to know the impact of this law on the people that he serves. And we do have a medical emergency. This mask is not working for me today. We do have a medical emergency rape and incest clause in the one in the state of Idaho, but he really does want to know what the impact of this is on our people. So are we thinking of developing a committee to really help us have data to support our legislation going forward?
Great question, and yes.
Yeah.
We've talked about a committee to do just that. We also have a website that you should also hopefully have seen when we released our statement that provides some talking points. And we're also working cross-organizationally with groups like ACOG, ACNM, MPWH, and SMFM to make sure we have shared talking points, we're sharing data, so we're trying to provide unity in the clinical care team as we share our messages with legislators.
Another one over here.
Good morning, everyone. Clifton Keenan. A couple of things, and I'm going to stay in the 2 minutes. The first thing is, this should not be a surprise. We knew this was coming, and we should have been prepared. We have been warned about this for years, and a Good Samaritan leaked this out, so this should not have come as a surprise. As a lactation consultant and as a person who works in diplomacy, I have to sign commitments on where I stand on issues on every board that I'm on. And I'm publicly calling on the AWHONN board. If you are a board member, you must be committed to comprehensive reproductive health care for all people in America. Anything short of that, you should not be serving. The second thing I would like to say, and along the terms of practicality, what do we do? Because people that look like me and people in my community, they will die. Not to mention, we're not really able to keep them alive in childbirth anyway. That being said, while everyone is carrying around Narcan, we must lobby drug companies, and we all need to be carrying emergency contraception in our purses and book bags and giving it out in our communities with advanced provision. I'm calling on AWHONN and other nursing organizations. We must create a legal defense fund so when our colleagues find themselves the victims of trigger and laws and harassment, we have money and legal counsel ready to support them. That's what progress is going to look like.
Thank you, Clifton.
Thank you. I did also want to
point.
thank you, Clifton. I did also want to say one of the partnerships that we're engaging with is with the American Prosecutors Association, because our philosophy is that we can engage them and educate them. If they're the ones who are bringing criminal charges, they may be a little more lenient. But that's a great suggestion. Thank you.
Yes.
Good morning. Excuse me, Barbara O'Brien from Oklahoma, which is the state with the most restrictive ban, currently banning any termination of pregnancy except for medical emergency to save the life of the mother from fertilization onward. And we also have the stipulation similar to Texas, where citizens can bring forward claims of this. So I think what AWHONN can do to us is, the reality is, what does a nurse say in a state like Oklahoma when someone wants to get an abortion in Oklahoma? Or, you know, what does a doctor say when their fetus is diagnosed with congenital anomalies that are incompatible with life? So how can we, in our reality, support these women that have to make these and pregnant people that have to make these difficult decisions? So I think AWHONN can do that for us. Simply just, how do you counsel, how do you respond when these issues face you coming forth?
Thank you.
Yeah, thank you for sharing that. And we're starting to look at those sorts of things. We started with the basic talking points, but as this evolves, we can certainly dig into it deeper, and I appreciate your comments. Thank you.
Hi, good morning. Kathy Ivory from Tennessee. 2 points. I wonder what AWHONN could do to partner with NPWH and other colleagues to expand our cadre of products and services for comprehensive women's health care. That's not been a real area of focus for AWHONN recently. So as we think about offering access to services, we need to empower our nurses with the competency to provide those services comprehensively. The second point that I would make is, how will AWHONN be a source of truth and a leader in aligning with our other professional nursing organizations, not OB and women's health related, who might be producing talking points and other things related to the ANA Code of Ethics, for example?
Yeah, I think a very important first step in that was the joint statement that we put out, and it did include other nursing organizations outside of our specialty area, like the American Academy of Nursing was on that joint statement. So we're making inroads. I think we have a lot more to do, but thank you for your comments.
And I will also say, even though we released a statement with those organizations, there's work we're doing with other associations like the Maternal and Child Health Programs Association, state and national organization, that are not specifically linked to nursing, but are MCH organizations, so we can be aligned in that way. Let's get Jean in the back because there are a couple folks back here, and then we'll come to Shakira.
Okay, Jean, way back there.
Chris Abyad from Austin, Texas. I think one thing we need to think about is we know that more than 50% of all pregnancies are unplanned. We need messaging about planning pregnancy, number one. And number two, we need easily accessible birth control family planning that is low cost, easily accessible. Every single person in this country who wants to prevent pregnancy should have cheap, accessible contraception. And the research right now is showing that more and more people are looking for long-acting contraception.
Yes, thank you so much. And that's a little bit a bit of a danger of what's happened with the overturning the Roe, because if you've been watching the news, this is a little bit of a slippery slope, and things like contraception are being included, that they're going to be legislated as well. So yes, all of us need to be on the, aware of what's going on, vote accordingly, whatever it takes to get the message out to the general public. But I appreciate your comment, and we will certainly note that. Thank you.
Can we do Shakira?
Hi there, my name is Aviva Kleinman. I'm from New York. Thanks for holding this. In the Northeast, we're anticipating an influx of people coming for care. So a couple of things we've been thinking about to echo what Kathy Ivory had said. Some of the states are looking at expanding scope of practice for NPs, midwives, and PAs. I would hope that AWHONN would be in support of that, because we're going to need additional infrastructure. Further, nurses who have never worked in that procedure are going to be, I believe, volunteering and participating in the work they've never done before with perhaps little time for orientation. I think it'd be helpful for AWHONN to have a clinical practice guideline that we can share en masse quickly if we need to. Because I don't think that people will have a lot of time to get ready, and we're hoping to hit the ground running.
Thank you for that suggestion. Excellent. Others?
Hi, my name's Claire, and I am from Virginia. I just first want to say, Clifton, thank you for what you said. I haven't even been a nurse for 2 years, and this is something that makes me very emotional. I treat a lot of Black, brown, and Hispanic women. And not being on a border, part of AWHONN on the board, only being 24 years old, I'm just thinking, what do I do when I go home other than vote? What can I do for these women? Do I go to Planned Parenthood? Do I volunteer? What can I do other than be a part of the voting process when it comes time? Because I want action in my state. I want to protect the women that I treat, and I want to be ready for the women that do come to my state to be in open arms. Because, when we signed up to work in women's health, we didn't sign up just for the easy birthing patients. We signed up to take care of all. We love them all, and we will fight for them all.
Thank you. And I hope this state, because every state has such individual needs, please be engaged in your political groups and policy groups within AWHONN, and let them know what you need, and let them, encourage them to send out state-specific information, resources, and what you need to care for the patients until we can do a better job of disseminating information to everyone. There's a question over here, Elizabeth, I think.
And then
right
Jean
there.
has one in the back there.
Oh, back there, too. Oh, I can't see Jean.
Is that me? Oh, you want to hold it? Oh, okay. Hi, I'm Jennifer Rousseau from Chicago, and as Sandy Cesario knows, a focus of my community work is with raising awareness about the safe haven laws in our state. While it's no means an answer to the situation we find ourselves in, the National Safe Haven Alliance does expect an uptick in an increase in the number of babies who are legally and lovingly relinquished by parents. I am speaking on this topic tomorrow, talking about the nurse's role with legal relinquishment. If you're not able to make that, please feel free to stop me to talk about the laws in your state. And I urge my AWHONN colleagues to familiarize themselves with the safe haven laws in their state. Thank you.
Thank you, Jennifer.
Shakira. And there's Elizabeth, there's a hand over here also. Whenever you get a chance.
I'm going to have one here. Okay, so I'm April Ronquillo, also from Oklahoma, but I work for the tribal government. And the women that I visit in the program that I manage, I work with just really severe poverty, women in poverty. And so my concern for them is that, but also I work as a forensic nurse, and I'm concerned about emergency contraception, and nobody seems to be able to give me an answer about that. Because tribal government, we fall in kind of that gray zone. So I would love for AWHONN to give me some guidance, give other nurses like myself guidance where we don't really know what's legal and what's not. And the only guidance I've been given is just don't talk about it other than with your victims. So I would love to see some guidance for other nurses in my situation who are working for tribal governments.
That's an excellent. I worked for Indian Health Service for a number of years, so I understand that gray zone that you're in, and we're under federal policy. But that is an excellent point, and we'll note that, and we'll see what we can do to look into that.
I think Elizabeth.
Elizabeth? Yeah.
Hi, I'm Kathleen Ellis from Texas. Two things that I want to bring up that might not be as evident with a lot of the discussion. One is the transgender community. There are men who have fully working, functional reproductive systems. And so the thought of how do we reach out to people who are already marginalized, sometimes multiple times with a lot of other issues. The other is, I'm a neonatal nurse by background, because so many abortions are because of conditions thought to be not compatible with life. Working in the NICU, I've seen some of those babies who've been born. We're going to see a lot more of those. So I'd like to see some position statements, information, support for clinicians and for families for neonatal palliative care.
Great points.
Great.
Thank you, Kathleen.
Thank you. Jean in the back, Shakira here.
You can see better. Jean, where are you? I can't even see you. Oh, there you are, way back there.
Hi, I'm Patricia Gilbert from Cleveland, Ohio. My question is, as things develop from state to state, is AWHONN going to have access on the website to guide us as far as what's legal in one state, what's not in the other, so we can advise patients?
As best we can, yes. And the resource that was released, that website that was released, that will have all those resources you're referring to. Shakira and then Elizabeth.
Good morning, I'm Bill Leininger. I'm an OBGYN from San Diego. And in terms of helping patients now, especially those who are most vulnerable, I'm with Society for Family Planning, and we're working on an outreach campaign to improve visibility for the National Network of Abortion Funds, which is a source of funding for women or patients to get to wherever they need to get to for their resources. I would love to talk to some of the advocacy committees or other members here about how we can partner to really spread the word about this. We've got templates for letters to the editor and op-eds to put in your regional papers. For the restricted states, a great place for people to say, I want to help patients get to their abortions. What can I do? And for the haven states, this is how we can help patients get to those safe, proficient, reliable resources.
Thank you for that.
Yes. Give me a business card or something. I'll be sure to share your information and with the appropriate people. Thank you.
Thank you. Elizabeth.
Hi. I'm from East Texas, and I'm very involved with organizations that in the community that provide baby supplies and stuff like that for free. And getting involved in that, I have learned about so many other organizations that are around that I wasn't previously aware of. And these women that are getting pregnant and aren't, I guess, affected medically by it, but financially, and how I would like AWHONN, if there was a way that we could compile, because nurses don't know, I didn't know until I got involved with the community what was all available, resources to help these women plan financially, homes for pregnant women where they can go and learn how to make changes to their life where they can accommodate more, another child, or, adoption services or things like that. I, as a nurse in the community, would like lists of things I could give out to my patients to help them make big changes in their life to be able to accommodate that, because that's more needed now than ever.
Great,
Thank you.
great point. Thank you. So noted.
I think we've got Jean way in the back.
I just can't see Jean. Okay, Jean.
Hi, everyone. My name is Kimberly Campbell Taylor. I'm actually from New York, and mine is to focus on the impact of the downstream consequences of this. Our neonatal community, looking at how do we take care of these babies that have some of these chromosomal issues, and also adoption. Foster care. What are some of the things that we will consider looking at this issue downstream?
Thank you for that.
We'll do our best to identify some of those. Those are things that we will be looking at, and we'll get information out to you and as much as we can. Thank you.
And some of these resources are on that website already, but we'll continue to update them based on the needs that we're hearing today.
Hi, I'm Robin Garrett, and I am from the great state of California. And I am very saddened over the years how our maternal mortality rates in this country is so poor. For being the United States, we should be the best, and this is going to impact it worse. So my weird question, and maybe this is making it too political, is AWHONN thinking about organizing any kind of protest on Washington?
So we have not talked about protesting. We do have AWHONN on the Hill, which gives us an opportunity, but we will bring that back to our Public Policy Committee and the board.
All right, we have about 1 minute left. I see Shakira has someone. Please.
Good morning. My name is Verita Henderson. I'm from Georgia. My comment is that, you know, it was, like Clifton said, we knew that this was coming. But we need to do more about the social determinants of health, because if you're going to have these babies that will be here, let's provide some resources for the full spectrum of life. Expansion of Medicaid is only a beginning. Other childcare resources. How about, you know, wonderful housing and education? All of those things we really need to do our part on. This has many downstream effects, and there's too many, but I love the fact that so many people are bringing up wonderful topics about this. Thank you.
Great, thank you.
Before we close, I think I do have one comment here.
One more.
Okay.
One more, 20 seconds left.
Hi, my name is Chris Lindeman. I'm from Oregon. I'm in the Emerging Leaders 2022 cohort. And as a nurse, I like to bring complicated situations like reproductive rights back to basics to better understand how I should respond. And advocacy is one of the most basic overarching themes to nursing, and has been defined as providing support for another person to help them express their views, wishes, and help them stand up for their rights. That being said, if you are a nurse and you're finding yourself unable to advocate for another human being's views, wishes, or rights, I think you really need to ask yourself, what are you doing here?
All right.
Can I
Do you have a comment?
Thank you for that. I did want to just share that one of the things that we're trying to do at AWHONN is think about our role as partners in this work. So there are things, great suggestions you've raised. Some things we'll be leading on, some things we'll be supporting and following on, some things we'll be sharing. So even with the suggestion around the protests, as we're figuring out what we're going to do, we will happily share what some of our other partners are doing, so we can all be standing together in solidarity as we move forward.
Well, thank you all for contributing. Yeah, this has been fabulous. We've got some great ideas. We'll take them back to the people who can have some impact, and we'll get you more information as much as we can. We want to keep this conversation going, so we do have the advocacy website. If you didn't get a chance to comment, I hope that you can email us, please, at advocacy@awhonn.org. Again, that's advocacy@awhonn.org. Please email us comments, questions, concerns, anything that you'd like to share with us. And also following this general session, we can continue the conversation in the right next door in this Aurora CD corridor that's immediately next to our ballroom. And it's a space for just informal dialogue or quiet space. So
that's from 10 to noon.
10 to noon, right after, after the general session that's about to occur. So 10 to 12. The AWHONN board and staff members will be on hand there if needed for further information. And again, it is such a sensitive and personal issue. I wholeheartedly am glad that you shared with us. So we ask that everyone remember to engage with each other respectfully and civilly as we have done this morning. Thank you, and our general session will begin in about 5 minutes. Thank you.